Perfect. Well, thank you so much for joining us at breakfast today. My colleague Ben was just joking that Guillaume and I are probably the most unsuited people from LEK for breakfast events because we tend to be very late night people. So we appreciate all you turning up at such an early hour, but maybe you all get up normally at 6 a.m. anyways, so this is already late for you. But thank you so much for joining us today. We'll talk about telehealth and digital health this morning. Got a bit of material we'll go through probably at pace, and yeah, feel free to interject with questions either as we speak or save them for later. Feel free to grab some breakfast, obviously outside, and with that, let's get started. So if we take a step back and say, how do industries actually transform, right? What we can observe from other industries besides healthcare is that usually you take your traditional methods, right, your traditional industry, and then you move them online, right? So where you had kind of stores, you can do, online bookstores, for example, right? That's the easy, I realize I have to stay here probably so you can all hear me. That's the kind of easy first transition. Then when you move to kind of industry 2.0, you already have things that begin to change a little bit. And then after a while, your industry 3.0 is actually the complete reinvention of what you're doing. The prime example, of course, is in retail, from stores to bookstores to online marketplaces to all of a sudden being the world leader in cloud computing. And one of the leaders in AI in the case of Amazon, or even Tesla, that began by looking at electric cars but is now building some of the largest electric batteries for the electric grids in Australia and I believe also in the UK. And so you can see initially people kind of think they know where the industry is going and where some of these digital companies are, and then all of a sudden they're somewhere else. And in healthcare, what we're beginning to see is some similar types of trends, right? So in the sort of 1990s, you had your traditional face-to-face encounters. Then in the 1990s and still today, you had your appointment booking online, and you had, the ability to maybe call your GP. But now what we're seeing is these telemedicine platforms, right? Your full-service primary care consultations, diagnosis, triage, e-prescribing, and your specialist consultations as well are beginning to move online, beginning to move to video or a phone call. And of course, where's this industry going to go? As the examples I just showed you, we don't know for sure, but we can see some trends, right? We can see that it will probably be seamless and holistic, integrated, whether you're doing something face-to-face or you're doing something online or you're doing something kind of at a distance via video. And ideally with the data, right, that's there, it'll be more patient and consumer-centric because that's where we start collecting a lot of additional data, right, in our smartphones with wearable devices and genomics and increased testing. And of course, because we're generating all that data, we'll have AI and analytics to build on that data. And if we look at the trends that are coming, if we kind of put the puzzle pieces together, we've got at the bottom left an exponential increase in computing. And that's one of my pet topics, as everybody that knows me knows, is that people don't really understand exponential change. With COVID, that's changing a little bit, right? We can see exponential means nothing happens for a very, very long time, and then all of a sudden a lot happens very, very quickly. Right? And if we look at computing power over the past 10 years, it's kind of increased tenfold. Over the next 10 years, it's going to increase by about 200-fold. And so there's lots of future experts to predict in the next 10 years we'll have as much change as in the past 100. So it's really hard to see this kind of exponential wave of computing technology and computing power approach and to see what it actually means for healthcare. But what we see in the upper left-hand corner is really the amount of data that's available, and you can sort of see very, very large numbers there. And of course, that data is generated by new means of diagnosis, whether that's for, or diagnostics for a genome or for other types of biome and all these sorts of things that we can measure from biology, but then all the digital biomarkers, right? How people move, how they act, measured by their wearables. And all this data has to be interpreted by someone. And it's not going to be your typical GP or your specialist, because they'd have to read, tons of material every day. And in fact, I think just in oncology, there's like 3,000 research papers published every day. And that statistic is actually old, so it's probably more than that. And so we definitely believe there will be platforms emerging that make sense of this data and that advise the physician in the future. All right. Now, even before COVID, you had some trends that were accelerating telemedicine. For example, increased user acceptance and expectations, right? People were using in all sorts of manner in their daily life digital devices to do banking, to do travel, to do everything. And the only, lone standouts in this trend were probably education and healthcare, right? And of course, both education and healthcare have been dramatically kicked into the digital age by COVID. Then you had increasing deregulation and reimbursement of telemedicine happening really globally, even before COVID already. We already talked about data and AI, and we'll talk a little bit more about these healthcare platforms and ecosystems that are emerging in the telemedicine side. Companies like Teladoc and Livongo in the US, like Cree, Health Hero, and others here in Europe. And what happened with COVID was that actually there was a whole bunch of new healthcare encounters that were actually unlocked, which is this yellow bit in the middle. You can see before COVID, of course, you had the triage hotlines where you could call and say, oh, I'm feeling unwell, and somebody would tell you, well, it doesn't sound that serious, wait until tomorrow, go see your GP, or sounds really serious, you should go to an emergency department. And you had the very high acuity use cases in patients that required constant monitoring at a distance. And COVID basically unlocked everything in between, because people could just not access healthcare because either the hospitals were full or people were afraid that they were going to get COVID, and so they started using telemedicine. Now, a few numbers really out of COVID. So 75% of patients actually experienced remote consultations for the first time during the pandemic. Over 50% in surveys that we did now actually prefer remote care or are indifferent. We're very happy. So we got 50% of patients that say it's absolutely fine to use telemedicine. And of course, if it's more convenient because I can get an appointment faster or whatever, or would be quite happy to use it. With physicians, right? 40% of physicians could consider spending part of their time working for a telemedicine platform, right? And 90% actually in the UK really value the benefit of triage so that they can see those patients that are actually more appropriate to them. And then, of course, we have the corporates. And corporates, on the back of COVID, are really interested in fostering increased healthcare for their employees because it's the right thing to do. It sends the right signal for COVID. It's oftentimes gives support for mental health, which is one of the key issues that have hit during the pandemic. And so corporates are really, really interested in doing more in telemedicine as a result of COVID. And the other thing worth mentioning is, of course, digital therapeutics. And I think the number of apps available are number now in the hundreds of thousands. We can see that there are more disease areas that are being covered increasingly as time goes on. The larger ones are exercise and fitness, lifestyle and stress. Mental health was a category that was hugely downloaded during the pandemic. And of course, we're seeing that digital therapeutics are being approved, right? So in the US, there's 25 that have been approved. There's another almost 100 in the pipeline. In Germany now, where digital therapeutics can be reimbursed through public health insurance, we have 5 that are fully approved and 15 that are provisionally approved. So there's lots of enthusiasm around digital therapeutics, but what we found is that some of these companies really struggle with market access. because, of course, the physicians are used to prescribing medications, much less used to prescribing mobile apps. And so patient access is really a big issue for some of these digital therapeutics companies, and there'll be, I'm sure, interesting partnerships in the future, for example, with pharmaceutical companies as well, given their large sales force. Now, where are the areas where we see kind of telemedicine and digital health hit? If we look at the continuum of care, there's actually quite a lot. There's wellness and prevention, often with mobile apps encouraging the right lifestyle and behavior change driven by insurance companies. There's triage and screening in the modern telemedicine platforms that we'll talk about a bit more. There's obviously diagnosis and treatment, calling up, say I'm sick, what do I have? Diagnosing, treating, and prescribing. There's disease management, and then there's kind of the monitoring elderly care. So all of these markets, all of these areas we can see being impacted and being served by telemedicine. So here I'll hand over to Guillaume. He's patiently waited. There you go.
So thanks, Klaus. So one of the areas where we're pretty excited about and we think we'll see more is around more test diagnostics sent to patients' home. So we've seen already a fair amount of e-prescribing and delivery of drugs to patients' home. So far, it's much more the prescription that arrives to patients' home than the drugs yet. But this is changing, and we think things will change as well with regards to diagnostics. So traditionally, diagnostics always been you go to a provider, whether a hospital or a diagnostic clinics, you do your test, you get the results, whether pretty immediately or a day after. But we see more and more emergence of sending test kits to a patient's home. Obviously, we've seen a lot of that with whether COVID antigen tests, for instance, and whether the test is actually just a sample collection analyzed in a lab, you get your results into an app or for your provider, or whether you can actually get your results straight in your own home. So we see emergence of that, and of course we'll also see more and more digital testing, typically through your smartwatch, analyzing sort of vitals or data that can be captured, more so for monitoring than actually diagnosis a condition. So to give you a sense, already, all different types of tests are available in a patient's home context, all different types of samples, and you can already see a whole range of companies that are involved in that space. And I think what's interesting to observe is there's quite a lot of different players who participate in this diagnostic to consumer testing sort of market. We have traditional lab companies, whether LabCorp with its Pixel brand for consumer, or others you can see on the left-hand side of the chart, as well as startups who are purely focused on tests at home. Some of the names here, whether it's Sarah Screen in Europe, TestCard in the UK, were growing pretty fast. But it's not the entire ecosystem, actually. What we also see a lot of companies, different types of companies, incorporating some element of D2C testing as part of their business model. Whether in Europe we have companies with quite different backgrounds, like colorimetrics, who essentially is a company that turns your smartphone into a mass spectrometer, whether to use in a healthcare application, industrial, or to test food and agriculture, or whether Cree, the famous telehealth platform. And in the US, we have similar types of companies, Teladoc on the telehealth side of things, or sort of more lifestyle-oriented companies like Lumen, who presumably you've also heard of, given the amount of advertising that's going on, was dedicated to men's health. So we see a lot of different companies sort of incorporating an element of D2C testing as part of their business model. And there is significant potential because, as we've seen for drug and e-prescription, something broadly similar applies for diagnostic testing. So from our own research, we look into how many of telemedicine encounters sort of required prescription and what happened, as well as D2C testing. So on the top of the page, you can see prescriptions. 10 to 30% of telehealth, telemedicine encounters are just to renew a prescription, which nowadays on some platform can be done very, very smoothly and automatically and without actually talking to a doctor. But overall, there's about half to 3/4 of encounters that require a prescription. Today, the majority of these prescriptions basically are delivered to home, but not quite the drugs yet. But we have about 10 to 20% of prescriptions where it's not only the piece of paper that comes to you, but the drug as well. On the testing side of things, we have about half or slightly less than half of encounters who would benefit from doing a test, but only less than 5% of these tests are delivered to home. And in about half of the cases, the patient is still left as its own devices to find and book the test. That's still not entirely sort of properly incorporated in telehealth business model comprehensively. So we see a lot of potential for growth in this area, whether with telehealth or telemedicine companies or with more dedicated specific players on the D2C testing side of things. Can't you conclude then? If you could.
Yeah. All right, so so how does all this come together? And I think one of the most fascinating themes to watch over the next couple of years will really be the emergence of these digital telemedicine healthcare platforms and ecosystems, right? And we have quite a few clients of ours that are struggling with this very question at the moment. We're working with one of the very large hospital chains globally, and they're asking this question. They're saying, gee, we think all these ecosystems are going to emerge. What should we do? Should we launch one? Should we partner? Are we going to become just a small service provider to a larger platform that captures all of the investor valuation? Where should we position ourselves? And so if you look at different geographies in the U.S., it's Walgreens, for example, with Find Care. There's lots of other emerging platforms in the U.S. There's obviously Teladoc and Amazon. If you look in Europe, I think one of the best examples is what Soros is building. They've acquired a telemedicine provider, Teleclinic in Germany. They've begun to struck pharma partnerships like with Novo Nordisk on obesity. They're beginning to link together health insurance, some insurance companies. I think they've begun in Switzerland here, which are kind of integrated e-commerce and telemedicine services for the insurance platforms. They've partnered with e-prescribing providers, which is, of course, natural because the more e-prescribing happens, the easier it is to use these online e-commerce pharmacies. But interestingly, they've also partnered with brick-and-mortar pharmacies because, of course, some people still, want to go there, and you have huge amounts of just walk-in customer access. So Soros is really trying to bring together all these pieces of the ecosystem, and also in Asia Pacific, we're seeing the emergence of some of these platforms in China, notably with Ping An Good Doctor, that are doing lots and lots of partnerships and others. So the question will be, how is all this going to shape up in Europe, and what are the general trends, right? And we can see if we look at, what are the options actually. If I'm one of these telemedicine companies and now I'm collecting hundreds of millions, if not billions of funding, what do I do with this funding, right? And of course, there's lots of different options, right? We can go into sort of hybrid brick and mortar presence, right? Like Cree in Sweden have opened up their own physical centers, and I think Medgate did something similar in Switzerland, and others are doing that. I can go into diagnostic testing, as Guillaume just explained, right, and begin to offer lots more of those tests, either develop them myself or partner with somebody that can do them for me. I can move into prevention and patient monitoring, so I can move up and downstream the continuum of care. I can look into e-commerce, like the Zorosa example, right? I can partner with an e-commerce company and launch my own, or maybe I am an e-commerce company and I'm branching out in these other areas. And finally, of course, the insurance bit is really important because it is actually then the payer, that drives value-based care, right? Because that's the big buzzword coming out of the US, of course, but it really means that insurance is paying for the right thing at the right time for their patients, obviously focusing on prevention before actually things go wrong. But then when they do go wrong, at least, utilizing those methodologies that are most convenient to the patient, that are often and nearly always also the cheapest, right? Because they're in their smartphone, they're where you are. And of course, when you look at these, potential expansion of ecosystems, there's lots of ecosystems partners out there that are more than happy to partner with you. Just by way of example, right, we have all those telehealth platforms with lots of funding. We have the diagnostic capabilities and platforms. We have e-commerce that is rapidly arriving. And of course, we also saw during the pandemic, we have a huge increase in the delivery services. So lots and lots of potential parties to look at and to bring together in these ecosystems of the future. And that's really it. So we've gone through in about half an hour. Very happy to take your questions, anything you might ask. Gil and I are here, and otherwise, of course, feel free to grab that extra coffee or croissant or any breakfast. Thank you. So, questions or not? The lady back there?
How do you see patient behaviors and motivations evolving through the next 3 to 5 years?
Well, we saw that through our own research that about 50% of patients are super happy to use these services, or indifferent. I think it's like, 30% happy, 20% indifferent. So you have a large amount of the patient population that is actually, very happy to use these services. But of course, I can see my dear colleague Tobias back there. It varies dramatically by country and culture, right? So even during the height of the pandemic in the UK, it was 50% of over 70% of patients use telemedicine. I believe in Germany it was about a factor 10 less, so you had 7 to 10%. And of course, that behavior is a cultural one. It varies deeply by country, and it really depends. So those numbers are global numbers, the 50%, but of course they're very different by country.
I was going to ask one point or two. One is clearly, for not for everybody, the telehealth sort of experience sort of works, but there's enough pool of people who are comfortable with it because it makes their life much easier. So there's a huge convenience, factor to be able to see someone remotely if you don't have a very serious problem, and if you're not an elderly with multiple conditions, for instance. The second point, though, is indeed there's big variations by country. And I think it's not going to be just the consumer expectation. I think the different healthcare systems are going to drive very different behaviors. Notwithstanding what we hear in the press in the UK with we want more face-to-face appointments for the GPs, there's about an article every day. The reality is that we don't have enough GPs to cater for the demand in the UK, and that a digital-first approach is really what's going to be needed to address the demand. On the other hand, in Germany, you might not have such level of pressure, and so the behavior will be much different, much less digital than, say, for instance, in the UK. So there'll be very big variations on a country-by-country basis, indeed.
The other point is that, of course, the patients aren't all the same either, right? So countries aren't all the same, and patient groups aren't all the same. I remember when Medgate was getting started, who were really one of the pioneers in Europe, right? They got started at the end of the 1990s, in fact. they thought that their service would cater to all the people that were living in distant places in Switzerland, right? Everybody high up in the mountains and, hard to reach. And in fact, what happened was that the biggest uptake was in young urban professionals, because they wanted the convenience of being able to call a doctor, as well as younger families, right, who might have had kids at home that they didn't want to bring into town for a complex appointment, or that were crying in the middle of the night at 3 a.m. So it was more the younger families and the young urban professionals that really ended up using these services the most. And that's, of course, those are the people that are most digitally savvy, and those are the ones that will, probably have the highest uptake. And then you often have this peak at the end where you have the elderly that either have their carers or other people kind of giving them the equipment or showing them how it works. And then because it's very convenient, they might not be as mobile, they tend to be using those services as well.
How do you think some meeting and maybe cooperation of the state-organized e-health and private activities? Because we already have a couple of good examples, Finland, Israel, Estonia, where the state organized maybe full e-health, and others come there as an alignment and did something more. They did something more there. Do you see some other examples in Europe?
I think I'll pass to Guillaume for that, because I think the UK has the NHS and you have a vibrant private system, whereas Germany is quite different in that regard. So
You have models like in Germany where really, fundamentally speaking, for outpatient type of activity, the state is mostly here from the funding side of things, and the delivery is largely independent, private for profit or not. In the UK, the model is a bit different, but we, clearly because of the NHS, but even within the NHS on the telemedicine largely conceived, it's very largely an independent private sector delivery mechanism. So of course we have all the telehealth vendors we know of, but NHS 111 is operated across the country by independent providers, some historically ambulance trusts, some for-profit, some client of ours, and even within that setup you have multiple businesses and stakeholders that look after different chunks of the service. So after NHS 111, you have, what it's called, you have some calls need to lead to a proper assessment. That's typically also done by a third-party vendor. So for this aspect, whether it's digital or physical health, there isn't a huge amount of differences from within a country. There's maybe a little bit more private sector activity because on the technological side of things, a little bit more modern, but it's mostly the healthcare system fundamentals that drive this, how the landscape sort of looks like.
I think in some cases also the problem isn't so much private and public collaboration, it's regulation. And even with COVID, you can see regulation in some countries is still erring on the conservative side. So for example, in Germany, there was a regulation pre-COVID that a medical doctor could only do 20% of the consultations online via telemedicine. They'd have to do 80% in person. Now, of course, in COVID, that was all waived. Now, generously, after COVID, they're talking about 30%, right? But you can see that, and that's often driven by physician associations, not even necessarily driven by the government. So you have the funding and the collaboration on one side, which is very country dependent on how these healthcare systems are set up. And then you have regulations, which again, sometimes are driven by politicians, but very often are driven by industry associations that do not want the industry to change, right? And healthcare is one of the very conservative industries where, different stakeholders have eked out quite a comfortable living in their particular niche, in their particular country funding situation. And any time that that's disrupted, that causes issues. And then, of course, you have people that say, we don't really want this and we need regulations to help us stop this, right?
Well, thank you very much for the talk, first of all. I think it's a super interesting discussion. And I was wondering if you have an hypothesis when you think of these systems merging together. So you have the telehealth providers, you have the brick and mortar, you have e-commerce, all these things. dominant, that they will control the market or the customer access, the patient access. Is there something of how you foresee this game going? And also, do you see, typically with platforms, you have a winner takes it all. So you have one or very few players who can dominate the patient access in the end. Do you see this here as well? Or do you see, let's say, just another patient touch point which multiple providers will be able to offer?
I think that's really the key question, right? If I'm an investor, that's exactly the question that I want to pose.
You have the answer.
Yeah, no, unfortunately I don't. However, and one of the things that we've seen, which we've not talked about in our presentation actually, is that there are these two trends, even just in telemedicine, right? Never mind the bigger platform play, but in telemedicine you have these two trends of kind of this software as a service, right? Where there's lots of companies that are saying, you GP, here's my video platform, and now you can telemedicine with all your patients. And then we have the kind of telemedicine brands, as we call them, like Babylon or Health Hero or Teladoc or others, or Cree, where people say, oh, I'm a patient of Cree. I'm not a patient of Doctor so and so, right? And again, here there's large cultural differences because in Germany you still have this doctor that you go to around the corner. So if that doctor now offers you telemedicine, that's great. That's just another way to see Dr. X. And it'll be interesting how in different countries these platforms manage to build up their own key brands so that I'm actually very happy to go to, Cree, for example. And I want to go there because I know they'll give me the best care. And so I think one element is really that brand. And I think, there's no inherent reason for one type of brand like a telemedicine brand to be favored over an e-commerce brand, if I'm looking at Doc Morris, for example, in the minds of the consumer, provided I can pivot that brand into delivering the healthcare service that I want at any one point in time. So if I know I'm getting great healthcare at Doc Morris, then I can, and I'm already their customer, happy customer through e-commerce and online pharmacy, then why wouldn't I go there? And so like with industry platforms, I think it's very hard to predict. Like I couldn't predict that now, but Guillaume, I don't know.
It's not a big prediction, but I think on your first point, I think what's going to work ultimately is for things that are integrated, whether it's all in-house or via partnership. I think both models can really work, and Thierry Chiche from Elzan yesterday talked well about how he's doing that with Levy in France. So ultimately, you can't do everything digitally. So at some point, things need to be able to move on to the physical world one way or another. And if that transition integration is handled well, that's all for the benefit of the patient and the organization who would deliver, would deliver that. And certainly, Levy or Cree in Sweden and also in France are pushing for having their own clinics as well, where you can go knock on the door, probably book your appointment online, but you can go there physically as well. We're talking here, pods in pharmacies to do teleconsultations. If you show up in a pharmacy, there's a need, for instance. On your second point, and typically in markets, such as France or Germany, where this telehealth platform, they need to compete to find the patients. So I think particularly in those markets, there is really a customer acquisition cost, but there's also a doctor acquisition cost, and you really need to be able to spin both wheels in a way that works. But yeah, the customer acquisition cost is pretty substantial, and it's not going to abate until there is indeed a little bit of a winner's take all. Within mental health, and in particular with a lot of it that's accessed via corporate funding, that may be a little bit different. We might still see more fragmentation, but within a country we expect some consolidation for the economics to work. This telehealth platform can generate a profit. Now, when you look at their financials, there are various stages of development and growth in different countries, so there's a lot of investments. But it's possible to make money, and not just in Switzerland, like
Maybe just to add to Guillaume, I think that is one of the key aspects, right, Guillaume, that you mentioned. What we also see from other industries, that if you can provide the best customer experience, that's always the way to win, right? Because in the digital world, the switching costs are going to really decrease, right? Especially in many countries, you now have shared care records, right? In Germany, for example, the Telematik-Infrastruktur and the elektronische Patientenakte. In many other countries, there's increasing sharing of healthcare information, right? Apple HealthKit and Google and all these other things. So your healthcare information will be more digital, and that'll make it easier, you know, assuming your payer, whoever that is, national or private, pays for it, to change platforms. And so if you have a platform that provides a better customer experience because everything is more integrated, then I think they will have a high chance of winning in the longer run. Oh, sorry.
It's probably also useful to talk a little bit about who owns the data and how the data are protected. So that's probably one of the reasons why people are reluctant to really go on all these different platforms. I mean, you have data everywhere, and then of course you have the data protection law in place in the EU, but everybody knows just signs somewhere down there in a lot of contracts that the data are somewhere. Are there any two ideas how you can deal with that, how you can really keep the overall data that you really then also can change providers and that you can be sure that these are also protected, because we all know most of these business models in the end rely on the collection of data. This is what we want. So that would be probably an interesting point to some more ideas.
Yeah, I think that's super important, and we've had experience in Germany where a lot of platforms had extremely negative publicity around the sharing of data. There was Vivi and Ada, I believe, for example, where some hackers and others discovered that data was being shared. Oftentimes that's not even malicious. It's because people are using some type of code that is using, again, some open source platform, and that might link to, somewhere in the US. And so sometimes it happens without malicious intent. Sometimes it does happen with malicious intent because you're trying to get extra revenue. And I think, that's one of the key issues why digital healthcare is always so local, right? In addition to the ecosystems, you have very local regulations. For example, when the digital therapeutics were first launched in Germany, the regulators said, well, you cannot have a US cloud provider. It must be Deutsche Telekom Cloud. And of course, the tech providers were not very happy about that. Neither were the developers, right? That were all, love to develop for Amazon Web Services and maybe IBM and Google. Deutsche Telekom, not so much. Good luck finding the programmers, right? And so that is the other issue. And of course, one of the key concerns in Germany was, where is the data being stored? Is it secure? If it's Amazon, is it as secure as if it's really sitting on German servers here? Even though Amazon, I think, can guarantee that, the servers are sitting in particular countries. But so the data protection issue, I think, is very relevant, but it's also different by country, right? There are countries that really care a lot about data protection. There are other countries that, frankly, don't, and it's also cultural.
And it's also very interesting to note, from current work we're doing with clouds, where if you ask an hospital operator in the UK what's going to be safer, the answer really becomes very often now, it's a public cloud. It's Amazon, Microsoft, Google. I've had the WannaCry experience with my on-prem solution. This is not working. If you ask the same question in Germany, well, it's the exact opposite answer. Public cloud.
That's where I want it. In my basement. That's
on paper. So the attitude towards this is very it's very different by country and of course generations. I just wanted to add a point on your point around data and telehealth companies. So to date, the telehealth sort of vendors, they certainly look at data and analytics, but at the moment it's not it's really around how we can queue patients to the doctor the most efficient way possible, so we don't have too many doctors compared to our level of demand, and can predict the level of demand and hence scale up our doctor pool. And giving the tools for the doctor to do a consultation in shorter amount of time rather than more, because it's an important argument to convince payers of the benefit of telehealth. If it's not cheaper than face-to-face, something is missing. But we're not, in the main, we're not quite at the stage where people are using data analytics in telehealth to deliver models of care. The main players are all looking into this and think about this, but it's not quite there yet in practice. The guidelines are still very much guidelines that you would see with a traditional physical provider, for instance.
I just wanted to add, I was just thinking about a discussion we had slightly earlier around the ecosystems. One of the issues that you have with these different ecosystems is the pressure for profitability. So one of the discussions that came up in the global hospital chain that I mentioned earlier is they said, well, people do expect us to have to deliver profit. But for some reason, with all these telehealth companies, they don't expect that, right? Even with public telehealth companies. Last I looked, Teladoc had a margin of minus 30%. I don't think they've been profitable in the last 10 years, right? And so that's a problem, right? If I'm an established provider in a brick and mortar industry with investors that expect profit, and I'm now saying I'm going to build up this digital and telemedicine platform, then I need investors that are prepared to go on this journey with me, potentially with less profit. And it becomes a portfolio play to sort of say, I've got a portfolio here that is established and profitable. I'm investing in this that I know is not going to be profitable maybe for the next 5 years. Maybe not ever, because it'll continue to draw in investors that are happy to go on this journey with me for the prospect of eventually being a market power.
Do you think telehealth is, because it's so accessible, people end up overutilizing it, and particularly in kind of the new payment models where it's fee for service, so we're going to see really high cost inflation, and then ultimately there'll be a bit of a notice about that.
I don't know, Guillaume, any thought there?
I don't think so, or at least no more than face-to-face consultation. So I think there are sort of two cases really. There is the consultation is paid by the insurer. So typically the way it works is the telehealth company negotiates with the insurer, not a price per consultation, but a capitated fee per insured member per year, or per activated member, per year. So it's down to the telehealth, company to guess what's going to be the utilization, from the different, insured members, and to negotiate clauses with the insurer whether, we need to agree. We need to agree a range, and if it goes over, we need to find a way, because otherwise I'm going to go bankrupt. So that's one model. And to help with this, the telehealth vendor are pushing more and more triage solution, whether it's basic, simple questionnaire, or whether it's more sophisticated sort of triage to push the digital first before you have the consultation, or it's sort of a pre-consultation. And then you have the public players like the NHS, where clearly if it's for free, we know in healthcare there's more utilization. There's more GP consultations per capita in the UK than there is in Ireland, for instance, and the difference is significant because in Ireland a good chunk of the people have to pay for it, and that's not the case in the UK. So on that aspect, whether it's digital or not, I don't think that's going to be a huge difference. And again, the same sort of triage element to sort of direct the patient to a consultation if needs be, and more importantly to the right person first, or clinician first time around. These are some of the tools that are going to help alleviate some of that pressure.
I think just based on my experience, I haven't heard really of overutilization. I think it might be a small percentage of people that would then try and do that. I do remember there was a study done, I believe in Switzerland also with Medgate a while ago on the fraud, because they were looking at patients that might be shopping for drugs, for example, pretending to be ill but not really being ill. And they found, I think, no difference between, the amount of times that happened in telemedicine services versus face-to-face. And in fact, with the telemedicine services, I think it was slightly lower because they were able to detect that, right? Because you can you see from your analytics how often people call. Whereas if I go to one doctor here and then one doctor around the corner and one doctor around the corner still, it's really harder to catch me. Anyways, so I think it was it.
Thank you for a great presentation this morning. First of all, you were talking about the traditional players, let's say doctors and hospitals doing their job regularly on a daily basis, and then you are talking about like the digital players to the doctor and telemedicine. What's in between? Where is the digital physical sector? Is it something you're looking at? Is it something growing? Because obviously the traditional players are becoming digital and the digital players are becoming more physical. What's becoming in between? Is there anything relevant existing and developing?
Well, I think it's either the one or the other kind of expanding out, right? So we have I think the example of Cree that Guillaume mentioned. So they're actually building physical infrastructure for their patients to go to. And likewise, you see companies that are traditionally brick and mortar that have expanded into telemedicine, right? Which you see quite a bit also in Finland and Sweden and others.
I mean, in between you have software vendors who provide tools, whether for physical or telehealth companies to help with triage of patients. Some have been acquired by telehealth platforms, but if you look at what Dr. Link does in the UK, it's HMRA approved a triage solution. And it goes on the front door of GP practices, it's going to go, since it's been acquired by Health Hero, it's going to go into the front door of consultations coming to Health Hero to triage them. So that may be one of the elements of in between. And maybe the other one is the ecosystem, I suppose the testing ecosystem. So whether you are a hospital or physical a provider or you're a telehealth provider, I think it'll be interesting to look into, what can I send to my patients at home, whether it's because I've discharged them from the hospital and I need to sort of monitor the post-discharge, or whether it's pre-hospital admission for specific tests, or simply because you have a consultation and you want to do a simple diagnosis.
Oh, the other famous example to me, what's in between would be like Dr. Lib in France, right? So all of a sudden you have a booking platform provider that then says, oh, and by the way, you can also video conference about my platform, and I'm bringing together the digital patient and the physical bricks and mortar, right? But again, those systems really depend on local reimbursement, whether it's capitated and whether the doctor is really interested in paying for a platform that brings them more patients because they're ending up earning more or not, right? So it works particularly well in France.
I'd like to answer that from Finland as well. So we are from Edila, and I see your competition here. We also that we are sort of traditional providers, and we've been able to build a digital presence so that our and our competitors have, I think, more than half of the population actually downloaded and used physical in Finland. So look at what's happening in Finland.
Yeah, great example. Thank you. Any other questions? Final 3 minutes, I think, then we have to kind of adjourn this morning, but very happy to take one or two more questions. Otherwise, thank you so much for turning up so early. Much appreciated.